Hello everyone, I'm Dr. Akanksha Rathi Maheshwari, Consultant Psychiatrist, Bombay Hospital. Today we are going to talk about the mental health effects of lockdown. At present, we are facing this crisis about the novel coronavirus infection, the pandemic that's affected all across the globe. We all know the physical health effects caused by this coronavirus. Let's find out what the mental health effects are. At present, we are in the situation of lockdown. Otherwise, in our routine lives, we go out, meet people, we go for work, children go to school, and at these times, every one of us has wished for things to change. Working people often wish, I wish I don't have to go to work anymore and I keep getting my monthly salary. Children often wish, oh God, don't let there be any more exams, let me just get promoted to the next class. Wives often complain, I wish my husband stays more at home, spends more time with me. Our parents often complain, God, let our sons and daughter-in-laws be more at home so that they can spend time with us, talk to us. All these wishes, and God said, so be it. And now we have all this extra time on our hands, but now we don't want this. We are suffering. This is just basic human nature. We always crave for something that we don't have. Because of this human nature, we are facing a lot of psychological issues, a lot of mental health problems at this moment. A few of them being boredom because of not being able to go out. A feeling of loneliness. Worry about uncertainties about the future. Worry about our jobs. Worrying about whether or not our businesses are going to be affected, worry about the economy. People are also worried that there might be a scarcity of food. A lot of people are hoarding groceries at home. A major worry that people have is what if me or my family member gets affected by the coronavirus? What if I get infected with COVID? All these worries, all these thoughts, they cause a disturbance in our mental stability. They cause what we call anxiety. In simple terms, it's called stress or tension in routine words. Now, if I were to ask you, how many of you at this present moment are suffering from anxiety? I'm sure most of you are going to say, oh no, I don't have any anxiety. I'm not stressed. Let me tell you this one very important thing. When we are anxious, it's very difficult to identify that we are anxious because we don't know the symptoms of anxiety. We are not aware of what anxiety means. So let's focus the discussion now on the manifestations of anxiety. The most common and the important ones being irritability, changes in our mood, easily getting angry, having arguments over very trivial issues, restlessness, forgetfulness, inattention. Usually in routine lives, things that seem so obvious and things that you always remember, people start forgetting them, start making mistakes. There are changes in sleep, changes in our eating habits, changes in appetite, which could be either increase in appetite or decrease in appetite. Another major symptom of anxiety is a preoccupation, which means repeated thoughts throughout the day, constantly worrying a person. Thoughts about future, thoughts about their jobs, anything. Now, the cluster of all these symptoms, the anxiety symptoms that I'm describing, in the present situation, because it's related to the coronavirus, it's being called corona anxiety. There's also another term for it, which is cabin fever. You've all heard of exam fever. Before an exam, people generally get stressed, they tend to forget things, they get easily irritable, they get easily annoyed. Similarly, this is cabin fever. They're not enclosed in cabins, but in the house, so hence the term. Two other things that I would like to mention here. When I said about preoccupation, There are two more issues that we are facing which are symptoms of this anxiety: catastrophizing and futurizing. Now, let's take them one by one. The first one, catastrophizing or catastrophization. As the term indicates, this means that when we are faced with even a small situation, we tend to exaggerate it and get worried about it out of proportion. To take an example, if I think that if I get the coronavirus infection, I'm going to be admitted to an ICU, I'm going to get very serious, what's going to happen to me? Now, we all know the WHO statistics. 70% of cases affected by the coronavirus, they show very, very mild symptoms, just symptoms similar to common flu, common cold. People don't even need hospitalization in 70% of the cases. But when we think that if I get the coronavirus infection, I'm going to get serious and admitted to a hospital, to an ICU, this is catastrophization. The other term that I mentioned is futurizing. As the name suggests, we are thinking about something that hasn't happened yet in the present. We are thinking about something that may or may not happen in the future and worrying about it. For example, India's economy is going to slow down. I'm going to lose my job. We don't know all this in the present, but we're still worried about it. So all these things, irritability, changes in mood, changes in sleep, appetite, preoccupation, catastrophizing, futurizing, these are all symptoms of anxiety. Now if I ask you again, is anyone out there suffering from anxiety? I'm pretty sure a lot of you are going to say, oh yes, I have noticed changes in my mood. I have become a little more irritable than usual. So if you are facing any of these problems, you're going to find the next part of my talk really helpful. We've discussed the problems, we've discussed the symptoms. Now, how do we get over this? What is the solution? Let's take the solutions one by one. The first thing, don't worry about things that you can't change. Focus on things that you can. In this situation, this crisis situation, the things or the factors that are leading to anxiety can be divided into two. One being the non-modifiable factors and the other being the modifiable ones. The non-modifiable factors, like we discussed, what's going to happen to the economy, how long is this lockdown going to last, what's going to happen to my job, all these factors are non-modifiable, they're non-actionable. You can't do something about it. So don't focus on them. Instead, focus on the modifiable ones. Like, how do I prevent myself from the infection? We all know simple steps that we need to take: wearing a mask, maintaining a distance of at least 2 meters from other people, covering your nose and mouth when you're sneezing or coughing. Take action on these things. These are the factors which are in your control. So work on them. That's my first step. Secondly, and very importantly, please limit your information intake. In situations of crisis, we are generally bombarded by extensive inflow of information, be it from news channels, be it from our WhatsApp groups, be it from any other updates that we get. Constantly looking at these sources of information, constantly discussing this with your family members leads to unwanted anxiety. Please limit your information intake. Please limit the negativity you absorb from these sources. Thirdly, limit your screen time. Now, we all follow this even in our routine lives. We generally tend to say that, oh, I'm just going to use my screens for an hour and then I'm going to focus back on my work. Because we are free right now, because we have all this extra time, maybe you can take a couple of hours for your screen time. That's up to you to decide. When I say screen time, I mean everything including laptops, TVs, mobile phones, desktops. One thing that I would like to clarify at this time, screen time is generally of two types. One is an active screen time, which is also called as a positive screen time, and the other is negative or passive screen time. Active screen time is when you're learning something using an e-learning platform, or maybe video conferencing with someone, you're in a meeting with someone, or you're calling any of your friends or family members via video call. These are all active screen times where you're actually involved. Passive screen times are when you're watching something on TV, you're binge watching your favorite Netflix series, or when you're reading your WhatsApp messages. So when I say limit screen time, I would urge you to decrease your passive, your negative screen time as much as possible while maintaining a healthy balance with your active or your positive screen time. These are the solutions that I'm telling you, these are the tips that will help you overcome this anxiety. The next thing I would like to say is this term that has become really famous in the last few days, social distancing. I would urge you to use another term, physical distancing. Maintain a physical distance from other people while maintaining a social contact with them. Because of the lockdown, obviously we are not able to meet our friends, our relatives who stay far away. Don't cut off from them. Maintain connectivity on social media. Call them on video calls. So I would urge you all to maintain physical distancing while maintaining social connectivity. The other thing that that appeals to our common sense is, because there is no house help, obviously people are getting burdened inside the house. Generally this burden tends to, one person in the family tends to suffer from this burden more than others. Why not sit down with our families? Why not divide the work, divide your household chores? This way the burden on one person is going to be less, and obviously stress levels are going to be less in the house. You have so much of free time. Utilize this time for other productive work, following your hobbies, doing your pending jobs, spending time with your family members. Apart from these things, 3 other things that we should maintain even in general in our routine lives, and more so in times of anxiety, in times of crisis: physical exercise, a balanced diet, and adequate sleep. Physical exercise, whatever is possible in the house, maybe walk on the terrace, maybe do some activity inside the houses. Physical exercise releases endorphins, which in turn lower your stress levels. A balanced diet is obviously very important at this time to boost your immunity. Adequate amount of sleep. Maintaining adequate sleep, as well as maintaining your day-night cycle, which is called as the circadian rhythm, is essential to reduce depression and anxiety. These tips in general to help you during this time of crisis. Apart from these, I would like to mention something that we often overlook. We don't really realize the importance of these things. Mindfulness, or as we call it simply meditation or yoga. Do follow it. Express gratitude. You have so many things in life that you should be grateful of. Practice gratitude. Help someone in need. Practice altruism. When you help someone, or when you even offer to help someone, there's release of this neurotransmitter called serotonin, which is the feel-good hormone, or the feel-good neurotransmitter. It will drastically reduce your levels of stress, your chances of going into anxiety or depression. I hope you find all these tips helpful and you follow at least a few of them. The one take-home message that I would like to share with you today: at the end of this lockdown, whatever tips you may have followed, whatever you may have done, the one emotion that you do not want to feel at the end of this lockdown is regret. Because that is what is going to make you feel worse after the lockdown than you were feeling during it. So go on, enjoy your time, make good use of your time during this lockdown. Wish you a happy physical and a happy mental health.